Hello, and welcome to our COVID-19 update, where we'll be speaking to the Minister of Health, the Honorable Dr. Frank Anthony. Hello, Minister. Thank you for having us today.
Thank you for having me on the program.
Okay, Minister. Now, before we jump right into COVID-19, can we speak a little bit about the Smart Hospitals initiative? I know that the Diamond Hospital would have been almost completed, and we would have started on Lenora. Can we have an update?
Well, Diamond, we are expecting that the uh, contractor would be handing over the facility shortly. My understanding that it's almost completed, and now they can hand that over to us so that we can put it back into operation. I anticipate by later in the month that we'll be able to do so, and we're now waiting for that handover process. With Lenora, construction is ongoing, and they have 9 months to complete the construction there. My latest report that I've received, I understand that they have now done quite a lot of work externally, and they would start doing some internal works shortly to redesign the flow of the hospital. So that's ongoing, and they're on schedule. In Mabaruma and Letem, we also have these smart projects that are ongoing, and we are monitoring to see how those projects are unfolding. Uh, the other one, the fifth one, is Paramakatoy, and that hasn't started as yet, but we are expecting that we'll get that up and running shortly. So we have five hospitals that are currently with the Smart Hospital project, and we are very optimistic that they're all coming on schedule.
So, Minister, I have to ask, once they start doing the internal works, this means that some of the services would be disrupted. And I know, say, for instance, Lethem and Mabaruma and Paramakatoy, given their location, what would be the plans in place to have the services, people access the service at different health centers?
We're trying to minimize the disruption. At Lenora, alternative arrangements have been made for the facilities next door to take up some of the challenges, if you like, if services are disrupted there, and similarly with those other hospitals. So we're working on it. So far, there haven't been too many complaints about the disruption, and we are trying to push the contractors to finish in a timely manner, even before the actual date of the contract. So if we can get that sorted out, that's going to be really good.
Okay, thank you for that, Minister. Now let's turn our attention to some myths surrounding the vaccines for COVID-19. I know some people are concerned that after taking the vaccine, they may suffer paralysis, meaning that they won't be able to walk. Can you dispel this rumor?
In the clinical trials, there was one case where someone developed paralysis, but they had actually stopped the clinical trial, did a complete assessment of what was going on, and they found that there wasn't any connection between the vaccine and this person who developed these signs and symptoms. So there's no need to be worried, because other than that singular case, which had no connection, there weren't any other thing that was reported. Of course, like with any medication, any vaccine, we have to constantly monitor to see if there's any complication that has been developed. And the AstraZeneca vaccine has been rolled out to millions of people around the world. Nothing like this has been reported. The Sinopharm vaccine, which we're also using, has been administered to millions of people in the Middle East, in China, in parts of South America. And again, none of this has been reported. So I just want people to understand that the protective effects of these vaccines outweigh whatever little side effects that you might get when the vaccines are being administered. And those side effects are really a little bit pain on your arm or a little bit of fever. But after a couple hours, that is gone, and your immune system would start developing antibodies that would protect you from COVID, and I think that is what is important. So again, I'll urge people, if you have an opportunity to get the vaccine, please go out and get the vaccine.
They're also worried about suffering mental issues and infertility as well. I mean, you would have just mentioned that the protective side of it outweighs the side effects.
But I don't know what mental health issues people would have with receiving a vaccine. Vaccines have been around for a long time, probably more than 100 years. When you go back to the history of vaccines, this thing really works. And I am not aware that if you receive a vaccine that you'll get mental health problems. I haven't seen that in the literature. I know there are a few people who have extreme fear of needles. But outside of that, because that's a phobia that a tiny group of people might have. And so they're afraid of the needle. But vaccines protect people. We have seen vaccines and how they work with children. We are immunizing children. Every year we immunize our children. We have been giving out now 18 different types of vaccines or antigens to protect children from 18 different types of diseases. And it has been working because we don't see those diseases in Guyana. And it's the same with COVID. Once you take your vaccine, you will be protected. And I don't think for all these years that we have been immunizing children that we have seen any mental health problems in our children, right? So I want people to be very clear. They would have all kinds of persons making up all kinds of stories. You don't have to believe all these stories that you're hearing. Get it from a competent source. Get reviewed in your news using the science. Go to maybe scientific sites on the web if you're using the web for your research. So go to competent authorities. And we have a number of those competent authorities that you can go to fact check if you want. The Center for Disease Control in the US is a very good site. The World Health Organization has been running a good site that explains everything about vaccination and so forth. Very comprehensive. And there are many other organizations like the Lancet, the UK, one of the UK's most prominent medical journals, have been putting out a lot of information as it relates to COVID. In fact, they've created a special COVID-19 center where they're putting a lot of information on COVID. Johns Hopkins University has been running a dashboard and providing a lot of scientific information as it pertains to COVID. So you can go to the real authentic site that would provide you the science, the rationale behind some of the decisions that we're taking to ensure that people get the right information.
Okay, and lastly, the last myth that I want you to bust is the fact that people saying that the COVID-19 vaccine Sinopharm, which came from China, has the virus in it.
Well, again, none of the vaccines that are available to fight COVID is using a live virus. Vaccines are made by taking small or tiny parts of the virus and you incorporate it into the vaccine so that your body reacts to that little part, that tiny part. And that's how you are able to stimulate the immune system. So all the vaccines that are available would mimic maybe a tiny part of the virus, but that tiny part of the virus cannot give anybody an infection, right? Because that's how it's designed. So vaccines would provoke your immune system to work and produce antibodies so that it fights off this disease without giving you the COVID infection. That's how vaccines would work, right? On the other hand, if you are infected, you are getting the full live virus who enters your body and can cause a lot of problems for you. Vaccines don't work that way. Vaccines give you the benefit of protection, stimulating your immune system, without you getting the infection. And that's very important for people to understand.
Thank you for that, Minister, and thank you for your time today. This has been our COVID-19 update. For more information, visit our website dpi.gov.gy or our social media platforms.